As a hair transplant surgeon, some of our results are immensely satisfying for us, especially so when it is a bit challenging, like a crown hair transplant in this case, which is quite difficult than front hair transplant. Also, some of the patients who come to us as a patient initially become a part of our Saraswat Hospital family, and this one is just the same. So let us dive deep into how we planned, executed the surgery, and what the patient himself has to say about his transformation. My name is Dr. Satya Saraswat. I am a MBBS, MS, MCH, DNB gold medalist, plastic and cosmetic surgeon with a special interest in hair transplant, and I am also a diplomat of American Board of Hair Restoration Surgery as well as a fellow of International Society of Hair Restoration Surgery. I have been doing hair transplant and hair loss treatments for last 20 years and have helped thousands of such patients. If you want to know scientific and genuine information about the hair transplant and hair restoration, please do subscribe to our YouTube channel. So this patient of ours, when he first came to us few years back, he came for the consultation but could not plan his hair transplant at that time because of the paucity of time, as he was traveling from Gold Coast, Australia to India in a very short duration of time. Then he planned his procedure in 2025 January, and he planned his hair restoration for the crown. Also here I would like to tell you about our PeekAI app, a feature which predicts your hair transplant results using a AI simulation. Link to that app is given in the description below. As we have discussed, this was just an isolated crown in a 37-year-old patient. Isolated crown, as we all know, are quite difficult to perform because of multiple factors. The first factor is the natural whorl formation in the crown, where the hairs are going out in a radial direction. They are spreading out radially rather than being straightforward parallel as seen in the front. Like in the front, the hairs are like this, whereas in the crown, they are coming out like a whorl pattern. So because of this, when the hairs are parallel, you can see less of the underlying skin. When there is an angle between two emerging hairs, this leads to increased scalp show. That's why the crown results are quite difficult to achieve. And similarly, in his case, like we do in all our cases, we did a trichoscopy and we found out his donor site was very, very good. His recipient area in the crown was around 55 centimeter squares, and we planned a density of around 32 follicular units per centimeter square for that, which gave us a number of around 1760 grafts were planned for him. His entire technical details about the trichoscopy, the grafts, number of 1, 2, 3, 4 hair grafts is shown to you on the screen here. After this, we did his blood test and performed the entire procedure in various steps as the standard protocol with us, like marking the area, doing the sensitivity test, doing all the investigations, then slit making, where in the crown we have to be very, very careful that the angle and direction have to be very, very precise. Then the graft extraction is done, and then the graft insertion. In crown, it's slightly more difficult because the patient is in the face down position, and for us also technically, because every time we are seeing what should be the natural angle and direction at which the hairs are coming out. So we performed his entire procedure. After the procedure, he came for the first shampoo with us at around 5 days, and then he flew back to his country, Australia, and then he was in regular touch with us, with our team, and we were guiding him about what to do, what not to do, what medicines to take and all that. And then he came to us after 1 year for the routine checkup. If you also are suffering from crown hair loss, please mention crown in the comment section below, and we will guide you about how to tackle this, whether this can be improved by medicines alone or you need a hair transplant or some other therapies. Also, please like the video if you're liking the content till now. The technique being used in this case was FUE. Graft extraction and insertion was performed without too much of a break, so that there is less of time between the graft extraction and the insertion. Out of body time has to be kept to minimum, and it is said that if the grafts are not inserted back within 3 to 4 hours, there can be some damage to the transplanted hairs. So this was the same thing we did in his case. If you are also planning a hair transplant for yourself, you can reach out to us by WhatsApping your pictures or calling us at the numbers given on the screen here. Now on the screen you can see his before pictures and the after picture and the combing video of the crown hair transplant, and you can see the flow of the hairs. His whorl was situated in the upper outer quadrant, and there can be 4 situations of the whorl, anatomical variations of the whorl. In his, it was upper outer quadrant, and you can see the natural flow of hairs flowing from that center of the whorl toward the other part of the crown. It's coming out very, very nicely, and the results look very, very natural for the crown. Also, you can see what he himself has to say about his results.
जी मेरा नाम ब्रिज पराशर है, मैं गोल्ड कोस्ट ऑस्ट्रेलिया में रहता हूँ. I had some issues with the hair loss, especially in my crown area, and I was constantly losing hair. तो जब मैं इंडिया आया, I was looking for a good hair transplant surgeon. मैं जयपुर गया, दिल्ली गया, and then somebody recommended Dr. Saraswat. तो जब मैं उनसे मिला, the level of confidence, the level of comfort I received and assurance from him, I was very much confident that this is the place I should get my transplant done. I got it done last year, January, and you can see the results are amazing. I'm just here after a year. I'm just to do a normal general checkup, and I'm pretty much happy with everything. The staff is very professional. The other clinical boys, they are also very professional. I was in constant touch with sir and his staff during while I was away, and he just kept on sending me whichever the prescriptions I required during that time. So I would highly recommend anyone जो transplant कराने का सोच रहे हैं. It's the only place. और कहीं भटकने की जरूरत नहीं है आपको. Thank you.
And in the end, I would like to say a special thanks to our patient who gave us this very, very beautiful card of Bhagwan Shri Krishna. And in this card, he gave a very heartfelt blessings and a message for us and our team. We really feel very, very happy and motivated after receiving such precious gift from all our patients. So this is a beautiful card. There's a message here which is very personalized for us. I just want to say how touching it is to receive such handwritten notes in this time of artificial intelligence and whatnot. If you find this video useful, then you can share this with anybody who may find it further useful for himself or herself. If you want to know more about crown hair loss and hair transplant, how we plan it, you can click the video given in the link above. Thank you.